CNA Practice Test 100 questions updated for 2024 full exam prep. Question 1. Normal signs of aging include: Option A is slowed response time. Option B, a temperature regulation changes. Option C, a vision changes. Option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 2. Changes in the respiratory system due to aging include: Option A, decreased air exchange in the lungs. Option B, increase in varicose veins. Option C, a slower response time to pain. Option D, bone becoming brittle and breaking more easily. The correct answer is option A, decreased air exchange in the lungs. Decreased air exchange in the lungs. Question 3. The type of tissue only found in the integumentary system is: Option A, matrix. Option B, smooth. Option C, epithelial. Option D, nervous. The correct answer is option C, epithelial. Epithelial. Question 4. Janice is an older resident who has been asking to go to the bathroom nearly every hour. She has also had some incontinent episodes, which is unusual for her. She has no complaints of pain, but you notice that her urine is cloudy and smells. You suspect that Janice may have: Option A, a kidney stone. Option B, a urinary tract infection. Option C, diverticulitis. Option D, atherosclerosis. The correct answer is option B, a urinary tract infection. A urinary tract infection. Question 5. A common sign of a cerebrovascular accident is: Option A, a flat effect. Option B, one-sided weakness. Option C, red, swollen joints. Option D, increased cough. The correct answer is option B, one-sided weakness. One-sided weakness. Question 6. A gradual thinning of bone tissue is called: Option A, kyphosis. Option B, a rheumatoid arthritis. Option C, a contracture. Option D, osteoporosis. The correct answer is option D, osteoporosis. Osteoporosis. Question 7. A tissue type that lines the inside and outside of the body is called: Option A, matrix. Option B, smooth. Option C, epithelial. Option D, nervous. The correct answer is option C, epithelial. Epithelial. Question 8. Platelets are fragments of cells that help the body to: Option A, fight infection. Option B, clot after an injury. Option C, maintain temperature. Option D, maintain fluid balance. The correct answer is option B, clot after an injury. Clot after an injury. Question 9. Maurice is one of your residents whom you are taking care of today. When you enter his room, you notice that he is shaking and appears anxious. His skin is sweaty and cool when you touch him. He seems confused when you ask if he is feeling all right. Maurice may be experiencing: Option A, hyperglycemia. Option B, hallucinations. Option C, hypoglycemia. Option D, peripheral vascular disease. The correct answer is option C, hypoglycemia. Hypoglycemia. Question 10. A common way to keep wandering residents safe is by using N. Option A, restraint. Option B, microchip. Option C, GPS. Option D, alarm system. The correct answer is option D, alarm system. Alarm system. Question 11. The inability to speak or form words is called: Option A, receptive aphasia. Option B, hemiplegia. Option C, expressive aphasia. Option D, dyspnea. The correct answer is option C, expressive aphasia. Expressive aphasia. Question 12. You have been assigned to take care of an older woman with Parkinson's disease. Symptoms you might expect to see include: Option A, hand tremors and slowed body movements. Option B, red, swollen, and painful joints. Option C, fever, cough, and night sweats. Option D, a frequent urination and fruity breath. The correct answer is option A, hand tremors and slowed body movements. hand tremors and slowed body movements. Question 13. Side effects associated with cancer treatments include: Option A, fatigue. Option B, weight loss. Option C, mouth sores. Option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 14. Respite care can be offered in the form of: Option A, adult day care. Option B, assisted living. Option C is skilled nursing care. Option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 15. Stage 1 cancer is: Option A, small or slow growing. Option B, a large tumor confined to one area. Option C, a large tumor that has spread to a different area of the body. Option D, none of the above. The correct answer is option A, small or slow growing. Small or slow growing. Question 16. Increased swelling in the legs, frequent urination at night, and shortness of breath are common symptoms of: Option A, peripheral vascular disease. Option B, a chronic pulmonary obstructive disease. Option C, congestive heart failure. Option D, diabetes mellitus. The correct answer is option C, congestive heart failure. Congestive heart failure. Question 17. A modifiable risk factor that greatly increases the risk of developing cancer is: Option A, a high BMI. Option B, a low BMI. Option C, high blood pressure. Option D, a genetic predisposition. The correct answer is option A, a high BMI. A high BMI. Question 18. The CDC encourages healthcare providers to make HIV testing a part of care for: Option A, residents in high-risk categories only. Option B, residents in healthcare professions only. Option C, all residents 13 to 64 years old. Option D, only high-risk residents 13 to 64 years old. The correct answer is option C, all residents 13 to 64 years old. All residents 13 to 64 years old. Question 19. The most common type of dementia is: Option A, avascular. Option B, Lewy body. Option C, Alzheimer's. Option D, Parkinson's. The correct answer is option C, Alzheimer's. Alzheimer's. Question 20. A good way to decrease pocketing food in the cheeks during mealtime is to: Option A, use sippy cups. Option B, use rubber-tipped spoons. Option C, offer a drink in between each bite. Option D, offer finger foods. The correct answer is option C, offer a drink in between each bite. Offer a drink in between each bite. Question 21. A good way to increase caloric intake for a resident receiving cancer treatments is to offer: Option A, fresh fruits and vegetables. Option B, large portions of calorie-heavy foods like cream sauces and fatty meats. Option C, ice cream, smoothies, and protein shakes. Option D, popsicles, fruit juice, and tea. The correct answer is option C, ice cream, smoothies, and protein shakes. Ice cream, smoothies, and protein shakes. Question 22. The type of therapy that helps a resident feel a sense of purpose and boosts self-esteem by bringing back a sense of meaning is: Option A, reminiscence. Option B, activity. Option C, validation. Option D, sensory stimulation. The correct answer is option D, sensory stimulation. Sensory stimulation. Question 23. One of your residents appears nervous and states that he has an appointment for a biopsy. This means that he has an appointment for: Option A, the removal of a small number of cells. Option B, the type of cancer treatment. Option C, the loss of hair. Option D, the type of radiation. The correct answer is option A, the removal of a small number of cells. The removal of a small number of cells. Question 24. Jonathan is a resident who has dementia. He wanders throughout the facility and often strikes out at the nursing assistant caring for him. An appropriate area for him to live would be A, N. Option A, locked unit. Option B, subacute unit. Option C, integrated unit. Option D, step-down unit. The correct answer is option A, locked unit. Locked unit. Question 25. You are assigned to bathe Kathleen, a dementia resident who is afraid of the water. You should: option A, wash the resident's hair at the end of the bath. Option B, offer a complete bed bath instead of a tub bath. Option C, be calm and supportive. Option D, do all of the above. The correct answer is option D, do all of the above. Do all of the above. Question 26. The number of people in the United States currently infected with HIV is: option A, 60,000. Option B, 100,000. Option C, 500,000. Option D, more than 1 million. The correct answer is option D, more than 1 million. More than 1 million. Question 27. The number one risk factor for developing dementia is: option A, age. Option B, genetics. Option C, brain injury. Option D, smoking. The correct answer is option A, age. Age. Question 28. The disease that is commonly referred to as the silent killer is: option A, hypotension. Option B, myocardial infarction. Option C, cerebrovascular accident. Option D, hypertension. The correct answer is option D, hypertension. Hypertension. Question 29. One example of sensory stimulation therapy might be: option A, giving the resident a hand massage. Option B, talking about the resident's family. Option C, helping the resident play bingo. Option D, assisting the resident during a fishing trip. The correct answer is option A, giving the resident a hand massage. Giving the resident a hand massage. Question 30. You work at a local nursing home as a nursing assistant. One of your residents has fallen while trying to self-transfer. In order to activate EMS, you should: option A, contact the administrator. Option B, call for the charge nurse. Option C, dial 911 and wait for the ambulance. Option D, call the nearest emergency room. The correct answer is option B, call for the charge nurse. Call for the charge nurse. Question 31. Alopecia is a loss of: option A, appetite. Option B, a hair. Option C, self-esteem. Option D, weight. The correct answer is option B, hair. Hair. Question 32. The function of the body's T cells is to: option A, carry oxygen to the cells of the body. Option B, help blood to clot. Option C, help the body fight off infections. Option D, provide proteins needed for cell health. The correct answer is option C, help the body fight off infections. Help the body fight off infections. Question 33. The goal of activities therapy is to: option A, maintain a resident's hobbies and interests. Option B, keep residents busy throughout the day. Option C, maintain the resident's ability to care for herself. Option D, restore gross motor skills. The correct answer is option A, maintain a resident's hobbies and interests. Maintain a resident's hobbies and interests. Question 34. A symptom that a resident is likely to have in the early stages of an HIV infection would be: option A, yeast infections. Option B, visual disturbances. Option C, Kaposi's sarcoma. Option D, night sweats. The correct answer is option A, yeast infections. Yeast infections. Question 35. According to Erik Erikson, the life stage at which people typically wish to contribute to the next generation is: option A, middle adult. Option B, senior. Option C, young adult. Option D, adolescence. The correct answer is option A, middle adult. Middle adult. Question 36. The clinic where you work discovers that one of its employees has tested positive for HIV. The clinic can legally share this information with: option A, the employee's residents. Option B, the physicians. Option C, the employee's doctor. Option D, no one. The correct answer is option D, no one. No one. Question 37. An intervention that can help a resident feel safe would be: option A, pushing the resident in a wheelchair. Option B, providing the call light before you leave the room. Option C, taking the resident to the restroom on a schedule. Option D, shutting off the lights at night. The correct answer is option B, providing the call light before you leave the room. Providing the call light before you leave the room. Question 38. The incidence of HIV infection in healthcare workers is low because: option A, HIV testing is standard for all residents. Option B, standard precautions are routinely used. Option C, facilities have post-exposure procedures. Option D, healthcare workers are routinely tested for HIV. The correct answer is option B, standard precautions are routinely used. Standard precautions are routinely used. Question 39. The greatest risk factor for contracting the HIV infection is: option A, unprotected sex between men. Option B, a drug use with contaminated needles. Option C, unprotected sex between heterosexual couples. Option D, receiving blood transfusions. The correct answer is option A, unprotected sex between men. Unprotected sex between men. Question 40. Asking a resident what she wants to eat today is a good example of meeting her need for: option A, safety. Option B, love and belonging. Option C, self-actualization. Option D, esteem. The correct answer is option D, esteem. Esteem. Question 41. The term esteem refers to: option A, a person's full potential. Option B, establishing good relationships. Option C, respect or admiration for self and others. Option D, meeting basic human needs. The correct answer is option C, respect or admiration for self and others. Respect or admiration for self and others. Question 42. A preschooler has met his developmental milestone when: option A, he trusts the primary caregivers. Option B, long-term relationships are started. Option C, he learns new skills and principles. Option D, he wants to contribute to the next generation. The correct answer is option C, he learns new skills and principles. He learns new skills and principles. Question 43. Anna is a 28-year-old home health resident whom you assist once a week. She is positive for HIV. Today she tells you that her infection has progressed to AIDS. This means that her life expectancy is: option A, 6 months. Option B, 1 year. Option C, 2 to 3 years. Option D, 5 to 7 years. The correct answer is option C, 2 to 3 years. 2 to 3 years.